Hello, this is Dr. Grande. Today's question is, are avoidant personality disorder and social anxiety disorder actually different disorders? If you find this video to be interesting or helpful, please like it and subscribe to my channel. That way you won't miss anything new. Now, this is an interesting question about avoidant personality disorder and social anxiety disorder, and I've discussed this in other videos. In particular, one video where I talked about the differences between these disorders. But I think when I look at these different mental health topics and I read more literature, it makes sense, at least once in a while, that I'm going to end up revisiting a question that was the same as one that I've tried to answer in the past. I read more literature, I learn more about the topic, and also new literature comes out, so there's new information available about the topic, and the discussion continues. There's a debate in the mental health treatment community about these two disorders, and sometimes it's really not a matter of how are they different. It really is a matter of there are people that believe that one of these must not exist. And I think the one that gets targeted more often, of course, is avoidant personality disorder. In previous videos, I've also discussed how we have to use the research sometimes on social anxiety disorder to draw inferences about avoidant personality disorder because there is not a lot of research on avoidant personality disorder. So really this just speaks to the same challenge. Are these two disorders really separate? Is avoidant personality disorder just a severe variant of social anxiety disorder? How can we conceptualize and understand this construct as it relates to one or more disorders? So I'm going to revisit this question, but from a slightly different angle. I'm not going to go through the item level analysis of the symptoms like I've done before, but rather give an overview of these two disorders and an overview of where we are in terms of their understanding. So with social anxiety disorder, there are many symptom criteria. I'm not going to go over them as I mentioned, but in general, we see fear, anxiety, and avoidance in social situations. And with social anxiety disorder, this may be specific. There's even a specifier, performance only, that's for performing or speaking in public. So the idea here is that social anxiety disorder is not conceptualized as the manifestation of extreme personality traits. Rather, the symptoms of this disorder can come and go. They're not really necessarily stable over time, as I indicated. So we could think of a short version to remember what social anxiety disorder is all about is really something like performance in social situations. Now when we move to avoidant personality disorder, we are conceptualizing a disorder here that is more stable. It's a maladaptive pattern like we see with all personality disorders. The pattern here is one of social inhibition. So we see a lot of different emotions and feelings associated with social situations, like a fear of being rejected, criticized, embarrassed, feelings of inadequacy, being inept, or inferior. So you can see this is quite similar to social anxiety disorder, but from a different angle. So if we try to sum up what avoidant personality disorder is like, we would say there's difficulties here in forming relationships. So we could easily remember the main difference between these disorders as forming versus performing. Difficulty in forming relationships with avoidant personality disorder, and difficulty performing in social situations with social anxiety disorder. So there are many theories about these two disorders, as I mentioned. There's a theory that avoidant personality disorder is simply a more severe variant of social anxiety disorder. This theory is actually fairly popular. There's another theory that avoidant personality disorder is really just a more stable form of social anxiety disorder. There's the difference between forming relationships and performing in social situations that I mentioned, and there's also theories that avoidant personality disorder really doesn't exist. That what we call avoidant personality disorder is really an extreme manifestation of social anxiety disorder. So where do we see agreement? Well, most everybody in the research community and the mental health treatment community believe that these symptoms of fear, anxiety, panic, and avoidance do tend to group together, that there's at least one distinct mental health disorder that we can identify here, and perhaps more than one. The disagreement comes more in the form of how does avoidant personality disorder fit in with social anxiety disorder. So to answer the question of whether or not these two disorders are really distinct, I used an article that was published in 2016 by Torvik and colleagues. Now this was a fairly interesting article. It was a twin study, and it looked at the differences over a long period of time between these two disorders. Now one of the limitations of this study was that all the participants were female, but one of the strengths of the study was a fairly large sample size. So the finding here was fairly interesting. Now remember, with social anxiety disorder, that disorder is thought of as less stable than avoidant personality disorder. But the findings in this study were that both avoidant personality disorder and social anxiety disorder were equally stable from early to middle adulthood. The level of stability identified was also moderate. So this really breaks away from the conventional thinking with social anxiety disorder and avoidant personality disorder. This idea that social anxiety disorder is less stable and avoidant personality disorder is more stable. Really, they're equally stable, and that level is moderate. So it makes social anxiety disorder look a little bit more like a personality disorder, and avoidant personality disorder look a little bit less like a personality disorder. So what the authors concluded here, and I think this is reasonable, is that stability doesn't seem to be a distinguishing factor between these two disorders. Another interesting finding here was that over time, the level of co-occurrence between these two disorders increased. Now we know that the comorbidity between avoidant personality disorder and social anxiety disorder is high. There's quite a bit of overlap. So if somebody has one of those diagnoses, they're at a greater risk to have the other. But we wouldn't necessarily expect the co-occurrence to change over time. It may stay stable, it may decrease, which would be surprising, but here it increased. The co-occurrence increased over time. The last key finding I'll talk about from this study was the difference between the genetic contribution and the environmental contribution to both of these disorders. Interestingly, they found that the genetic influences were different for avoidant personality disorder as compared to social anxiety disorder, but those genetic influences were highly correlated. They also found that the environmental contribution was more important in terms of developing the symptoms. Again, this is a little surprising considering with personality disorders, we know that the genetic contribution is usually about the same as the environmental contribution, usually around 50% genetic and 50% environmental. So when looking at these findings, the authors concluded that social anxiety disorder is actually distinct from avoidant personality disorder, which may be a little surprising considering a lot of the findings seem to point in the other direction. But one of the keys here is the result of the factor analysis, which is a type of statistic that looks at the underlying structure of a construct. And here there were differences found, fairly significant differences, between these two constructs. So yes, there's a lot of similarity between social anxiety disorder and avoidant personality disorder, but they do appear to be distinct. It's important to note here that this is an interpretation of the evidence, so somebody could read this article or an article like it and determine something different. But I think if we look at all the evidence presented, it is reasonable to think of these two disorders as distinct. There's a lot of overlap between them, but there's enough that's different to call them separate disorders. And of course, there does appear to be a different treatment plan, at least to some extent, for each of these disorders, and different outcomes could be expected. So if we look at the characteristics of these disorders, it does appear logical to keep them distinct. I hope you found this description of avoidant personality disorder and social anxiety disorder to be interesting. Thanks for watching.